In this video, I am going to be talking about the major causes of premature ejaculation and the treatment. But before we dive into that, I would like to give a general overview of what premature ejaculation is all about. My name is Edith Ndoka, and I remain your dynamic nurse. Premature ejaculation can be a very frustrating and embarrassing situation for most men. In fact, about 30% of men experiences premature ejaculation. Premature ejaculation can be normal in some cases and abnormal in other cases. It's usually normal when a man experiences it once in a while, okay, due to some situations or occasions. But when it keeps occurring frequently, it is no longer normal. And what is premature ejaculation? Premature ejaculation is described as when a man has orgasm or releases before penetration or shortly after penetration that they did not like. Okay, so during intercourse, the average period of time for a man to ejaculate, according to research, is about 5 minutes. But this does not mean if a man comes maybe a little above 5 minutes or a little below 5 minutes that it is not normal. It can be normal, like just like I said before, in some situation. But when it is frequent, that means it is no longer normal. There are two major types of premature ejaculation. The first one is the one we call primary or lifelong premature ejaculation. In primary or lifelong premature ejaculation, this is when a man experiences premature discharge from the very first time of their sexual intercourse, okay, or they experience intercourse. So this keep happening from the first day until continuously. And we also have the one we call secondary premature ejaculation. In secondary premature ejaculation, this individual usually have normal period of time of ejaculation, but all of a sudden started experiencing premature ejaculation. Now let's go into the major causes of premature ejaculation. The causes of premature ejaculation can be classified into two. We have the medical causes and we have the psychological causes. Some of the medical causes include overactive thyroid. We all know that once the thyroid gland is overactive, it is going to be secreting excess thyroid hormone. And thyroid hormone, when it is excess, it increases everything in the activities in the body. The second medical cause could be a condition known as prostatitis. This prostatitis is just inflammation of the prostate gland. The third medical cause could be hormonal imbalance. Hormonal imbalance, especially the oxytocin, can also cause a man to be experiencing premature ejaculation. We also have some neurological problem like multiple sclerosis. Another medical condition that could cause this problem is chemical imbalance. Research proved that low level of the hormone, the neurotransmitter serotonin, can lead to premature ejaculation. Another one is obesity. Now let's look at some of the psychological problems that can cause premature ejaculation. Number one is stress. Most people, when they are stressed, they can't control what is happening during intercourse. Another one is anxiety. Most men are anxious, especially about their performance during intercourse. So this could also trigger premature ejaculation. Another psychological cause is depression. Most people are passing through a lot mentally and psychologically. So when they are depressed, they tend to perform less during intercourse. Another psychological reason could be relationship issues, especially when someone is feeling guilt. Probably they cheated on their spouse or their partner, or they did something they think is wrong. Okay, so that guilt could trigger them to have premature ejaculation. Another one is childhood trauma. Some people might have a terrible childhood experience and they grow up with that. So that could also affect their um, performance during intercourse. Another one is negative sexual encounter. So all these psychological problems can also make a man to always experience premature ejaculation. Let's talk about the treatment to premature ejaculation. The treatment can be classified into two: the drug treatment and the non-drug treatment. The drug treatment involves the use of antidepressants. Antidepressant has been proven to be an effective medication to treat premature ejaculation. They are also known as SSRI, but they have some common side effects like reduced libido, sleep disturbance, fatigue, diarrhea, headache, and nausea and vomiting. Now, let's talk about the non drug treatment, which is also known as some behavioral treatment. The first one is what we call the distraction method. In this distraction method, when one is having intercourse and he thinks he's coming to ejaculation, he can drift his mind, he can distract his mind towards ejaculation by thinking of maybe sport or any other thing that is totally abstract, or related to the intercourse activity. The next one is the one we call the start stop technique. So in this technique, the man withdraws and hold back when he is about to ejaculate until the urge to ejaculate goes down. Then he can continue. And he needs to continue repeating this until when he is ready to ejaculate. This particular technique takes lots of practice, and also you might also want to have a discussion with your partner regarding this technique, because some women can easily get fed up. Imagine stopping and withdrawing, stopping and withdrawing. Probably it is at the time when she's about to have orgasm, and then you stop and wait and withdraw. So you might have to discuss it with your partner so they will also be aware of what you are doing. It will really help. The third one is what we call the squeeze technique. In this squeeze technique, when the man is feeling the urge to ejaculate, he withdraws and stop and squeeze the tip or the head of his manhood and hold it for at least 20 seconds, and also have to wait for at least 30 seconds before he can continue. And he has to do this repeatedly until when he's ready to ejaculate. So like the previous one, you might also have to have a discussion with your partner, and it might also require some repeated practice for you to get used to this. Mhm. There are also other ways of treating premature ejaculation, which is treating the underlying cause. Okay, just in case there's other medical condition that could be predisposing you to this, like hormonal imbalance and the rest of them. So you know that you need to treat this underlying cause. Another one is going for therapy or counseling if you're having some psychological problem that is also affecting your ejaculation. Thank you for watching. I hope you've learned something new from this video. Please don't forget to click the subscription button and also the notification bell, so when next I post my next video, you will be among the first people to watch the video. Thank you for watching once again. See you in my next video. Bye.